I'm going to make a drawing now of a different perspective of an upper central incisor, just to explain a few other intricacies that are important for a dentist to consider when creating a youthful looking tooth. And that's what all my patients are looking for. When they come into my office, they say, "Dr. Rabanus, will my veneers look fake or will they look natural?" And of course, the reason why they came to me is because they want natural looking teeth. What are natural looking teeth? What are youthful looking teeth? And I'm going to make a quick drawing here. So this is the gums up here again, and this is a central incisor. Certain things about a central incisor or any incisor, well, upper incisors, are created by nature. Sharp angle here, round angle here, more convexity here, more like a straight line here. All this is part of a natural tooth. The isthmus, the zenith of the gum line is not right in the midline of the tooth, it's more towards the side, so this is where it is. All this needs to be looked at by a cosmetic dentist. And even though this is not the subject of this presentation, a cosmetic dentist needs to look at the gum line and establish that first before he actually works on porcelain veneers. This needs to be established. We have to have an anatomically correct position of the gum line, absolutely symmetric with the other teeth that would be coming in here, which I'm not going to draw right now. So what are the intricacies of a youthful looking tooth? We still remember that we have enamel, dentin, and the nerve inside. The nerve usually is not visible, but what you can see is the yellowness of the dentin and the bluish translucency of an enamel. That's a youthful tooth. The younger the tooth, the more transparent the enamel will be. And I will just draw it a little bit like this. So the enamel is somewhere here, and I will draw that out in just a moment. And of course it's three-dimensional. It will wrap around like this. And if the enamel is translucent, you will see certain intricacies in the tooth that you wouldn't see in an older person. And those intricacies are developmental lobes, dentists call them mamelons, that are yellower and opaque than the incisal edge of a tooth. This area here is supposed to be translucent, this is opaque. So this is called mamelon. Mamelon. Usually it's 3 of them, and they can be designed in different, nature doesn't create them absolutely symmetric, and they may have little grooves in here, so they're very irregular, but principally you have like 3 mamelons in a tooth. And if the tooth is youthful, when you put your finger behind this tooth up here, you will get rid of the shadow that's behind there. So it looks darker with the shadow of the mouth, but if you put your finger behind it, that area actually looks pink. That's translucency. That's a youthful looking tooth. That's a tooth of an 18 to 23-year-old person. In addition to this, you will see a very defining line right here, which is white. It's a well-defined line, which is like an effect of the light being reflected in this area, which is called a halo. So you will have a halo in this area as well. All this needs to be designed if you want to create youthful looking teeth. Now, how are you going to do this if you have a person who is in his or her 40s or 50s who doesn't have these characteristics anymore? How do you create the space that allows to have like a depth, a visual depth experience when looking in the patient's mouth? You can only do this if you reduce enough in certain areas. So up here it's not as critical. Up here you can get away with 0.5 millimeter of reduction. Here, depending on the shade of the tooth, if it's a light color, you can go 0.8 millimeter. But if it's a darker tooth, you have to go up to 1.1 millimeter. It really depends. And this is when if it's a straight tooth. We're just talking right now about color management and creating a youthful tooth. So this is actually a youthful tooth. All right, so just as a reminder. However, to create all these intricacies up here, you will have to reduce it by 2 millimeters. 1.5 to 2 millimeters. That gives you all the space you want to create all these beautiful little intricacies. And that way, you can create a youthful smile. If you have cavities already between your teeth, or if these teeth are crooked, misaligned, you will have add reduction to the areas that are sticking out. If this part is sticking out, you will have to reduce it, let's say, by another 0.5 millimeter. If this part is sticking out, you have to reduce it by a little bit more to compensate for the rotation of the tooth. In addition, if you already have fillings here, let me just make a drawing of the fillings. If you already have a filling in this tooth, and you have a filling here, well, you wouldn't leave those fillings in. You would remove them, and you would design a veneer that actually builds porcelain into this area. So you would have a wraparound of the veneer. And then you would go around. And I make it blue now so that it's clear what is actually the veneer at this point. Everything here and everything here is porcelain. And then you go around like, probably like this. And you go like this. And all this will be veneer. Now, the total amount of tooth structure that's being removed by a veneer like this is never more than 30%. If the patient 20 years ago had come to the office for cosmetic dentistry, he would have received a crown. A crown removes much more than 60% of a tooth structure. Sometimes it's 70 to 80%, or 70%, let's say. Veneers are still very conservative, even if they're designed this way. And now we would get all the intricacies here. So it's a conservative procedure. Dentin bonding agents are being used the proper way, and the patient will enjoy those veneers for the rest of his or her life.